Assalamu alaikum. Good afternoon from Malaysia. It's nice to be back after a gap of 2 months. Welcome to the 29th monthly webinar of MEDED webinar series. The topic, as you know today, is construction and conduct of multiple-part modified essay questions. The learning outcome for today's session, what we want to achieve is that the participants will be able to describe the format of multi-part modified essay question, explain the rationale for the use of modified essay questions for assessment, especially in integrated curriculum, discuss applications of modified essay questions other than assessment, describe the advantages and disadvantages of using modified essay questions as an assessment tool, construct multi-part MEQs, and conduct assessments using multi-part MEQs. So inshallah, we will try to achieve these outcomes during this session. First, let's talk about the essay questions itself. Essay questions themselves consist of a statement. The question itself is a statement, often several sentences long, that describes a situation or poses a problem. And the student's task is to write an essay to propose a solution for the problem which has been posed in the question, and the answer may be as short as a paragraph or may cover several pages. So this is the definition of an essay question itself. The essay questions require the candidate to generate rather than select an answer, means that they have to write an answer rather than select an answer as in, for example, multiple choice questions. And essay questions effectively shift the focus of assessment from knowledge of isolated facts to the use of basic science principles to solve problems. And that is the big advantage of essay questions, that they are much more than recall, but they emphasize on application of the basic science principles to solve medical issues. Types of essay question, broadly there are two types: extended response or open-ended are a classical essay questions. Most of us have gone through this during our undergraduate days. And then is the restricted response or modified. The extended response are classical essay type of questions. They have a greater freedom of response. They are open-ended. They involve a number of learning outcomes. However, they are too broad in nature, difficult to relate the question to the intended outcomes, and difficult to indicate the nature of desired answer. For example, question, describe a cardiac cycle. We are not sure whether it is in anatomically normal heart or in anatomically abnormal heart or both. Should it include volumes, pressures, or oxygen saturation? Are we talking about a newborn or an adult? And how long the answer should be? Can be a paragraph, a page. So the question is not really clear, and the students don't get enough guidance how to formulate the answer. On the other hand, restricted response or modified essay questions are highly structured. They are focused, relate easily to a specific learning outcome, Intent of the question can be communicated clearly and they are marked easily. For example, list 5 questions you would ask in the history taking of this patient to arrive at a diagnosis. Give one reason for asking each question. So this question gives clear guidelines to the students what they are expected to do. And therefore, these questions can be marked easily. The types of restricted response essay questions, there are 3 different types of restricted response: short answer, short essay questions, modified essay questions, and patient management problem. Today, we will be talking in detail about the modified essay questions. So what is a modified essay question? In the past, medical education, and especially the undergraduate course, has put a premium on didactic teaching, and I'm sure all of us are familiar with this because most of us have gone through this. And the obverse of the same kind on assessment by testing factual recall of information. So traditionally, it has been a didactic teaching from teacher to students, and assessment has been most of the time the recall of the fact. But we know the practice of medicine involves much more than this because it concerns with the application of scientific thinking. If we want to solve problems, just recall is not enough. We should be able to apply the scientific information and should have some other abilities to care for the people. And the application of this realization that we need to have the ability to apply the basic science knowledge in real life situations on the ground has led to the quest for a more problem-based approach to learning and assessment. Thus, the problem-based learning curriculum and the concept was introduced, and MEQ is also one of the results of this thinking. Modified essay question presents the candidate with a problem or a clinical situation and examines how he or she proceeds to tackle this problem. That is the basic concept of modified essay question. Modified essay question is an account of series of events as they unfold in sequence of evolution of a case or a problem narrated as they occur. For example, history, physical findings, investigations, management, prevention, community impact. So this really reflects the real life on-ground situation. So the MEQ would unfold this information in the same sequence as it happens in the real situation. And when it is presenting this evolution of information, at frequent juncture, specific questions are asked, which require a short written essay or answer, which then is compared with the model answer. So whenever we construct an MEQ, we have to also produce a model answer so that with that we can compare the students' response and assess them accordingly. So the key features of a MEQ is based on actual case. Most of the time we would take an actual case from the hospital and then modified or customize it to the level of the student. It is laid in a sequential fashion, sequential revealing of information, and it requires written responses to structured questions. The definition of a modified essay question for phase 1 students can be as follows. It is intended to examine the student's ability to explain physiological and pathological phenomena or mechanisms involved in the health and the disease. So we can, in our modified essay questions, especially for phase 1, we can ask questions related to the normal functions and the structures of the body, as well as the mechanisms or pathogenesis or pathophysiology of abnormal conditions or diseases. Whereas definition for phase 2 would be that it is intended to examine the student's ability to solve and manage clinical problems. So it would be advanced level for phase 2 students, and to apply basic and clinical sciences knowledge in relation to the particular problem. So fundamentally, we are looking at the student's ability to apply their knowledge of basic sciences, basic clinical sciences, to solve a particular problem. The problem solving in MEQ, as we know, the problem solving is defined as a logical, analytical, and systematic approach to establish the cause of a patient's problem, that is the diagnosis, planning treatment, that is the therapeutic management, monitoring the patient's progress, and supervising the convalescence and rehabilitation, that is the follow-up. So the problem-solving exercise would involve all these stages of patient management, and MEQ can assess all these aspects in one setting through data gathering, that is the history taking, generating hypothesis, differential diagnosis, hypothesis refinement, final diagnosis, and planning management, that is the treatment, both immediate and long-term, both curative as well as preventive. So basically, you can imagine that this is just like a long case examination, but we will see that how to apply this in real life situations and how it can be applied to especially the difficult cases. So this in MEQ, students needs to possess the knowledge of basic clinical sciences. They should be able to recall the facts and then relate each of these particular facts to that particular circumstances of the case under consideration. MEQ tests clinical reasoning, which is dependent on the identification and correct interpretation of certain clinical features and data. So with that concept and definition of a modified essay question, let's look at the format of an MEQ. It is usually produced in the form of a booklet, the loose papers, consisting of different parts, usually 3 to 5 parts, depending upon the time allocated. Most of the time, it is about half an hour for one question. The facer page or the front page provides basic information about the question and short list of instructions. This is an example of the facer page. That this is modified essay question 1, and for professional examination 2, and the instructions to the candidate that this modified essay question has 5 parts. Each part is on different colored sheet. We will talk about this, why we need different colored sheets. And each part is given maximum obtainable marks, and these marks are out of a total of 30. Each part is given an estimated time, and students can move on to next part as soon as they finish one. Students are expected to deposit their answer sheet in the box provided before answering the subsequent part. So means when they want to move from part 1 to part 2, they must deposit the part 1 first. And once they deposit this part, they cannot access it again. At one time, the student can have only one sheet and one color is allowed on the table. And that's how these different colors help us, that from a distance, the invigilator can see that if student has more than 2 colors on the table. And make sure your metric number is written on each sheet. So this is the example of instructions given to students for attempting a modified essay question. The second page provides a brief scenario outlining a clinical situation. Like the definition we talked about, the essay question consists of a statement and explaining or presenting a problem, and then it is followed by a set of questions with sufficient space for the responder to write an answer before turning to the next page. Here is an example. This is part 1, and it says that estimated time is 7 minutes. And then a brief scenario is given. Mrs. Alia brought files, her 5-year-old son, to the clinic with the complaint of increasing pallor for 3 days. Today, she noted that her son was passing dark-colored urine. So this is a short scenario, and which is followed by the questions. Question number 1, list 5 questions you would ask Mrs. Alia to help you arrive at a diagnosis, and give 1 reason for each question. And if you see for the answer, a table is provided where the space is given for 5 questions and also the reasons. And for each question, there is 1 mark for correct question, and then 1 mark for the correct reason for asking that question. So you can see that this is quite a searching exercise, that student has to ask relevant questions in this situation, and the questions that would help to arrive at a diagnosis, and then they have to explain why they are asking that question. The second question lists 2 causes of pallor and dark-colored urine in children. So this is mostly of recall type of question. Yes, Prof. Prof. Rashid, please unmute yourself. Prof. Rashid, you have raised a hand. Okay. Now, so this is the first part of a modified essay question, or first page of a modified essay question. So additional information is given on the subsequent pages and questions are asked. These questions can be simply recall of factual information depending upon what we really want to test. It can be interpretation of clinical or lab data in some particular situation. It can be expression of professional attitudes or outlining a management plan. We can even ask students to write a referral letter. And it may also cover community aspects of the problem. Sequence of scenarios on different pages depicts development of different stages of the problem. So each subsequent part gives additional information about that issue or a problem in a way it evolves in real life situation. Each scenario provides relevant new information and requires interpretation, clinical reasoning, and decision making at each stage. To avoid overtaxing the student's memory for case details, early information about the history or findings is summarized together with the new details in subsequent test items. This is the example. You see, this is the part 3, and in the first few lines, it gives a summary of the previous 2 parts. And then the new information is added below that. The summary, for example, finds a 5-year-old boy increasing pallor for 3 days, passing dark-colored urine for 1 day, and treated for sore throat with the herbal medicine. And so that was the information, summary of information was given in the previous 2 parts. And also the findings on examination is in the part of the summary. And then a new information is provided. And in this case, these are the results of the investigations. And if you see here, another advantage of modified essay question, that we can use pictures for different findings and ask students to relevant questions about that. For example, in this case, we have a picture of the sample of urine, and it is dark colored, and we can ask questions based on that. No reward is offered for great speed of students' responses, so that the total time allowed for each paper is generous. So we have to be careful about allocating the time. We must provide enough time for students to think and not first to read the scenarios and then think about it and write the answer. An estimated time is given for each part, and full marks for each question are stated. So by setting different levels of questions, as you saw in the example, there are questions on interpretation, there are questions of simply recall as well. So having these different levels of question, it is possible to predetermine a suitable mix of abilities, so we can mix the different levels of questions based on the stage of the students and what we really need to assess. Each part is set on a different page, and students progress through the scenario as it is developed without turning back. Means once they have deposited the one answer, they cannot go back to that, because most of the time the subsequent part would answer some of the questions which have been asked in the previous page. To make sure that student does not get access to the subsequent or previous part, student deposits the answer sheet in a box before moving on to the next part, and each part is on a different colored paper, as I mentioned earlier. That makes it easy for invigilators to spot if student is having more than one parts on their table. So the salient feature of a modified essay question, it is basically a pen and paper exercise. It is open-ended response format. It is patient-centered. It emphasizes on problem solving. It is a multidisciplinary or integrated effort. So many different disciplines can be involved in one MEQ, and each one can set questions according to their requirement. It provides a plan for students' time management and specific model answer for each item with marking scheme, which is an important part of modified essay questions. As I mentioned earlier, that whenever we construct these questions, we have to produce a model answer for each question. So how to select topics for modified essay questions? You can have a full list of the topics which you think you want to examine in that particular examination, a kind of, let's say, wish list. And then you can pick up the topics which you think would be examined in the long case. We know normally what kind of long cases appear in the exam. And then we strike out those conditions. Similarly, we strike out the conditions which will be examined in the short case or OSCE. And then the remaining questions, we select the appropriate topics which can be examined via modified essay questions, and then the short essay questions, and then the extended matching questions or best answer questions are multiple choice questions. So this approach helps us to avoid the duplication and asking the same questions again and again. Basically, this is concept of blueprinting, and it would be really much more than this simple exercise. The application of modified essay questions other than assessment, it is not something new. It's already more than 40 years old. Was used in 1969 by Royal College of General Practitioners as an additional means of assessing clinical competence. The statement given was that in an effort to gear assessment more fully to the realities of the practice of medicine in primary care. It has been used in different settings to measure the progress of trainees during training, preclinical, undergraduate, and postgraduate examinations, linguistic and medical competence of overseas doctors by GMC before the introduction of PLAB. It can be used and has been used for structured YOSA examination, progress of vocational trainees in general practice, clinical challenges in postgraduate magazines, continuous medical education, training workshops of different fields, including non-medical, and for teaching, integrated teaching or case-based learning. So it has been used in number of different situations and with different emphasis. Advantages of modified essay questions. They offer an opportunity for students to demonstrate competence in applying their knowledge in clinical problem solving. So that is the major role, application of knowledge in solving the clinical problems, especially when the use of real or simulated patients would be inappropriate for improbable. So this is where the really application of MEQ comes. These are, for example, cases, the important cases. We think that we should examine them, but they cannot be used as long case because of the nature of the case. For example, status epilepticus, or patient with coma or near drowning or head injury, or cerebral malaria or measles, the seasonal diseases, the patients may not be available for long case or short case. So these are the conditions which we can examine quite in detail in modified essay questions because they cannot be examined in clinical examination. It is a natural assessment tool for PBL curriculum. If you are following a problem-based learning curriculum, then this is one most suitable method of assessment. It is really close to real-life practice. The candidate is presented with successive pieces of information about a case, and it would have unfolded in the real practice. It offers structure and standardization, allows multidisciplinary involvement. That's another big advantage, that in one question, the different disciplines can assess the students. It provides strong educational diagnostic utility, means that the really assessment of the students, and is inexpensive in terms of materials used. This is an effective method to test analytical and decision-making abilities of the students, ability to apply knowledge in interpretation of data and for solving clinical problems, ability to provide explanation or justification based on the knowledge of underlying mechanisms like pathophysiology or pathogenesis, and ability to recall knowledge if we really want to do that in a modified essay question. It can test wide range of capability in one question: application of knowledge, problem solving, ethics, different level of cognition, the Bloom's taxonomy. The questions can be based on different levels of Bloom's taxonomy, from recall to decision-making situation. Experience with modified essay question during the final clinical year in Belfast confirmed the technique as capable of measuring the entire span of Bloom and Backwalter level of cognitive ability. So MEQ offers us opportunity that we can assess the students at a wide range of their ability. So one MEQ can test on history taking, interpretation of clinical findings, investigations, the requisition and interpretation of results, basic sciences, both recall and application, pathogenesis and pathophysiology, differential diagnosis and diagnosis, management, complications, prognosis, ethics, and epidemiology and prevention. So there are quite a wide aspect and wide range of abilities which can be tested in just one modified essay question. We can use illustrative materials, as I shown in the example. We can use ECGs, we can use clinical pictures, we can use even X-rays if we have a good printing facility, and they can be incorporated into the written text and questions framed to elicit interpretation, synthesis, and other higher order abilities. So many things which are difficult to write or explain, but providing their pictures, clinical pictures, can help to overcome that issue. It is an appealing tool both for formative and summative components of assessment, especially in an integrated curriculum. MEQs give us opportunity to perform the direct comparison of students' performance overall, and then from item by item and discipline by discipline. So that is again a big advantage of using MEQ. So after going through all these benefits, of course, there are some disadvantages as well. The first big thing is that it's not easy to construct. It's a time consuming. Again, difficult to mark because it's a hand mark as compared to multiple choice questions, which can be easily marked by using computers. More number of invigilators are required as compared to multiple choice question examination. Less objectivity as compared to modified multiple choice questions are OSCE, because and that is an inherent problem in essay questions, that the subjectivity, some degree of subjectivity is always there. Difficult to maintain balance of different levels of cognition. So when we are framing the questions, we have to judge our question based on, for example, Bloom's taxonomy, so that we can have an appropriate balance of easy and difficult questions. Students may have different understanding of the question, so we need to really train the students and inform them that what terms are used. For example, the term interpret does not mean just to say that this is high or low. They have to really combine the results to come to a conclusion. Similarly, lecturers have to produce the model answers, and these answers need to be validated, whether they have to discuss with their colleagues, and sometimes we have to vet the answers or test run these questions. The marking scheme needs to be flexible, because sometimes students may give an answer which is appropriate, but that has not been included in the model answer. So there should be flexibility to accept the right answers. The other problem is narrow range of topics, because only certain situations can be assessed in modified essay questions. But within each topic, it is possible to delve deeply into the various abilities, of course, depending upon the scenario presented. We cannot sample as much content as multiple choice questions per unit of examination, and that is an issue for essay questions. And the improvement in multiple choice questions and short essay questions have shown some advantages which are a part of modified essay question as well. Sometimes responses do not only show lack of competence, but potentially harmful. So this is a policy matter, that if a student response is not only shows the lack of competence, but they give an answer which is potentially harmful to the patient. So what should be done? Obviously, it depends upon the stage and the level of the students, but the medical school or faculty has to make a policy, and the assessor then must decide whether such incompetence should disqualify the student from promotion or certification, or whether specific remediation and further assessment will suffice. This is not only modified essay question, but that is an issue with any type of essay questions. Where modified essay question call for answer that required a specified number of acceptable answer. For example, the question is list 3 investigation, but students provide a larger number of answers, and more than expected number of responses, all are correct. Or maybe they have more than number of expected answer of responses. Some of them are incorrect, and maybe the initial one are incorrect, and the later part of the answer has the correct answer. So our policy has been that we would always accept the first 3 or whatever number we have, irrespective whether they are right or wrong, and we ignore the rest of the answers. The checklist for modified essay questions, we need to look at if the question is ambiguous or is open to interpretation. The writer expects a response which differs from the question asked, so we have to be very careful and very clear in formulating these questions. Clarity of questions should be grammatically sound. There shouldn't be any use of vague language or imprecise terms or unexplained abbreviations. Or if the question does not promote synthesis by testing a logical progression of the thought or failure of continuity. So we have to look into that the parts of the questions are linked to each other, and there is a natural or logical progression from part 1 to part 2 and subsequent parts. Failure at one point in the question may lead to failure in other parts, the dependent questions. So we have to be careful. It's easy to deal with dependent questions in modified essay question format because we can move those questions from one part to the next when the dependence has been addressed. We should avoid double negatives in the question, and unnecessary information should be avoided because the students spend time on reading these questions and understanding the questions, and unnecessary information may distract them. Going to other parts of questions, so one should be careful that we are not giving any clue to the answers. Question covers content which is not necessarily acceptable or contentious, so we should avoid the questions which are asking for information which is not agreed upon by everybody, because different students might read the information from different sources. So the questions should be based on the state information which has been accepted by all. And we should make sure that question is not too broad in the scope. Similarly, we have a checklist for marking scheme of these questions. Sometimes the scheme is incomplete because the model answer may not cover all the alternate answers. That's where vetting of these questions or discussing with colleagues helps. Scheme is highly specific and does not allow for minor variability from model response. As I mentioned earlier, sometimes students do respond and their answer is reasonable, but that has not been captured in the model answer. So there should be flexibility enough to accept those answers. And then make sure that scheme is not difficult to apply. Awards difficult fraction of marks. We generally follow that the minimum mark given for one component or question is 1 and not less than 1. Scheme is poorly weighted, inconsistent, dubious relevance, or application difficulty. In fact, the appropriate for the level of the question. We cannot expect the same level from first year students as year 5. So marking scheme has to be weighted properly. Answer length is not proportional to mark allocated, and answer significance or relevance is not rewarded adequately. Here is another issue that we give more marks based on the significance of the questions and the relevance of questions rather than the length of the question. And marks are awarded, make sure that marks are not awarded for the same answer at multiple points in the question. The next part, how to conduct a modified essay question, the practical situation. First, we will ask students to enter their metric number. The metric number students have to write at the bottom of the page, so they can write on each page without taking out these sheets from the envelope. Next page, I'll show you the example. Then they have the sheet counting and with different colors. So the invigilator would announce that and would count along with the students. Then they have to put that envelope which contains this question on one side, usually on the left side. And then they put the sheet in the box which is on the, so after completing the answer, they have to put the sheet in the box provided, and that is on the right side if the a question is on the left, and once placed in the box, they cannot access it again. One sheet, one color on the table at one time. Each part is given an estimated time, so students can move on to the next part as soon as they finished one. And every question is given marks. These marks are a total of whatever question marks for that question. Here is an example, and if you see, the student number is at the bottom. So students can write their metric number or student number on each page without looking at the question. This is that we want to make sure that students don't forget to write their number on each page, but you can also do this not in the beginning, but ask them to write their student number on each page when they answer that. So here is an example of a modified essay question for phase 1. That while preparing breakfast, Mrs. R had a little cut on her finger. She had mild bleeding, which stopped spontaneously. So this is a scenario. The question is, describe the mechanism that helped to stop bleeding in Mrs. R. Then the scenario continues that in the evening, Mrs. R felt some pain in her cut and found a bit of redness and swelling. And the question is, name the condition causing symptoms of pain, redness, and swelling and its pathogenesis in Mrs. R. Similarly, we can ask questions in relation to pain and swelling apart from inflammation. A day later, Mrs. R found some pus in her wound, and then the question that explained the mechanism of development of pus in Mrs. R's wound. Again, we can ask questions in relation to pus and bacteriology. So this is an example of a modified essay question for phase 1, and you can see the involvement of multiple disciplines from physiology to pathology to microbiology and bacteriology. In summary, the construction and marking of modified essay question presents a considerable intellectual challenge. Both activities can be time-consuming. Its advantages outweigh its disadvantages, and despite its shortcomings, modified essay question has stood the test of the time. With that, I thank you for your attention, and I will be happy to answer if you have any questions. Yes, Prof. Hamza.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
Prof, we are really very thankful for bringing the so beneficial workshops, webinars. Just very few comments and then some questions.
Right.
I remember that modified essay questions was very early, as you said. I'm sorry, I have missed some of your parts. So maybe something which is missed, so I can clarify from you.
Right.
So it was in RCGP when I have attended the exam in 19 something.
Yeah, 1969.
No, that was I was not born, and you mean so it is in 1992 or 93.
Right.
There was very strange type of MEQ because just one scenario and then you have to write a lot of things. Now it's becoming very clear.
Right.
And what I found that it is a very nice integration of the basic science and the clinical science and all these. Now, there are a lot of research that short answer questions, not the modified one, but short answer questions or very short answer questions coming back. What about the research in MEQ? Have you come across that now it is coming anymore and so on? Because it is a very nicely where the student, we can get them how to write and how to understand. Thank you.
Right. Yeah, I think that's right, because now we are realizing that simply selecting an answer, already prepared answer, is not really good enough, and we need to assess students' ability to analyze the information and make appropriate decisions. So the different types of essay questions are really needed for such situation. But at the same time, we have to address the drawbacks which are associated with the essay question. Thank you for your comments. Yes, Professor Aslam, please.
Thank you very much, Professor Alamsher. Nice to see you with good health. God bless you with happiness and good health always.
Thank you, sir.
My question is, one of the benchmark of Bloom's taxonomy, which was missed, is synthesis.
Right.
That synthesis part cannot be judged by the MEQs. This is an additional disadvantages of an MEQ. Is that right?
All right. So you see, every tool of assessment has its limitations.
Yes.
We cannot assess everything by using one tool. For example, doing the clinical examination and asking the students to really examine and tell the positive findings and interpret, of course, that can be done only hands-on. So that's why we use what they call is menu of examination tools, that we use different tools together so that one tool can cover the shortcoming of the other tool. You are absolutely right. That's why I did not mention that synthesis.
Right. Great. Thank you very much. Thank you.
Yes, Reham.
Yeah. Hi. Good morning, dear professor. Thank you very much for the very interesting lecture. So I have one question, if I may. You mentioned in the checklist that failure at one point in the question may lead to failure in other parts. So in a previous webinar, you mentioned that in short essay questions that I should make sure that I don't penalize the student for making the same mistake in dependent questions. And if possible, and there should be a faculty agreement on how to deal with that independent questions. And if possible, I should avoid them altogether. So it's not really clear what I should do with modified essay questions. So should I also avoid dependent questions? Or what do I do?
Right. Actually, thank you for that question, and the issue you have raised is really important issue. Modified essay question gives us the opportunity to avoid these dependent questions. For example, if you are asking the most likely diagnosis, and then you are asking the treatment for that condition, so that means the treatment would depend upon what the student has made the diagnosis. In modified essay question, we can move this dependent question from one part to the next part, because the subsequent part would provide answers to some of the questions which were asked in the previous question. For example, when we are asking the most likely diagnosis and asking the treatment, so if we move the treatment to the next part, because the next part we would be answering to the first question of the most likely diagnosis. So in this way, actually, if you look at modified essay question, provides us the best opportunity to handle these dependent questions. So whereas other essay type of questions do not help us to handle this situation. So in modified essay questions, we can move the dependent question from one part to the subsequent, where it would not be dependent anymore.
Oh, so this is actually perfect. So if I ask in the first part, what's the most probable diagnosis? In the second part, I can actually provide the diagnosis and ask my question about the treatment. That's perfect.
Yeah, that's absolutely right. And that is one big advantage of MEQ, that MEQ actually pulls back the student. If the student is diverting and going away from the case, the subsequent part would pull back the student to the real situation. So that is again a plus point for modified essay questions.
Okay, thank you so much. That's very clear. Thank you very much.
Dr. Fahad.
Thank you, sir. Assalamu alaikum. Thank you so much for the informative session. Sir, my question is that would you suggest and recommend any changes if you try to conduct an MEQ assessment online instead of taking it on paper? And sir, one more question is that my own perception was that MEQs are maybe more suited to clinical disciplines. So in your opinion, is it equally suited to both clinical and basic sciences, or does it favor clinical?
No, the two parts. The first you said is very interesting. The MEQ online, and it is being done in Singapore, at least I know. And that gives you a lot of power to use these questions. If you are doing online, you can even include videos, the pictures, and so many other things. Unfortunately, the software is not really developed, but if we can have a software for such questions, that would be really a tremendous support, and then our ability to assess the students would be really great. So that is one. And obviously when student answer one part and then they click the submit button, so they cannot access that part anymore. So that as you said is really a great situation to deal with. Sorry, the second part was the use of MEQ in preclinical. Like I gave you the example, the phase 1. So I think with little bit imagination, the MEQ can be used in preclinical years, and that makes it relevant because we want our students to apply that knowledge in the situation, and to make them realize that we are not trying to make them anatomist or physiologist or biochemist. We are preparing them to be the future physicians. So definitely it can be used in preclinical years, but of course we have to look at the scenario.
Thank you so much, sir.
Thank you. All right. Dr. Laikuzaman, please.
Assalamu alaikum, sir. Thank you very much, first of all, for a wonderful presentation as you always do. Thank you indeed. We are using computer-based software for testing MCQs, and this year, actually, we started using them for short answer questions. I had written to you this thing. If we have, rather than model answer, if we have phrases, the key phrases and words, you think technology could be helpful in any way to make those assessments rather than to have them being done by people? If I'm making myself clear.
Yeah, I actually know some of the work being done on that, using computers to mark essay type of question, and they're using the key phrases, and the yes, attempts have been made, but to my knowledge, it has actually still quite away from the perfection we need to mark these questions, because there are so many different ways of explaining something. So somehow then the software has to cover all the possible ways and phrases. But definitely, I am aware that work being done on that, but I don't think we are at the level of using that for making such important decisions where we are talking about the future of medical students. So we want to make sure that our basis of making such decision is really valid and reliable.
Okay, thank you. Can I put one or two questions more if there are no others?
Please go ahead.
I was wondering if you run the exercise of standard setting on these questions as well, like we do for OSCEs and OSPs and etc.
We have done on OSCEs, but not on essay questions yet.
You think it would be any useful in doing so?
I think if we have a good vetting session on our model answers, so that may be sufficient to handle this situation. I'm sure you realize that using this standard setting on essay type of questions is may not be easy. Whereas in OSCE, it's because there is a hard data. So then right. easy to use because they have a very standardized and clear marking schemes. In modified essay questions, if not overall, but for certain questions, we can use standard settings where the questions are very clear and answers are very, very specific. So not completely, but at least partially, I think that might be possible, but we haven't tried that yet.
And if I may ask, how many faculty members vet these answers, these model answers for you?
Yeah, basically there would be a central vetting committee which has a fixed number, like usually headed by medical educationists. But then we would call the relevant disciplines when we are discussing those answers. The advantage is that the relevant faculty is there, and then there are some people from other disciplines. So sometimes the people from other discipline might see the question in a different way than the faculty. So that is the advantage of that, but obviously it needs time and energy to handle that.
Thank you very much, Prof. Very thankful indeed.
Right. I think I don't see any more hands raised. Thank you very much, everybody, for your attention. As usual, I have to share two more slides. The one is our next webinar, which would be on developing rubrics and marking schemes, and it will be conducted inshallah on 22nd of January. And the next is my usual appeal of donating $1 USD or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in your community. Thank you very much, everybody, for your support.
Thank you, sir. Thank you, Prof. Alamshir.
Thank you, sir.
Thank you, Prof.